Hello, everyone. We're here today with John Saunderson, the head of radiation protection and radiology physics at Hull University, teaching hospitals and NHS Trust, and chair, who is also the co-editor of medical and dental guidance notes that we're going to discuss today. And especially its second edition. The title is also in collaboration with our partners in IPEM. Welcome, John.
Thank you.
So, would you like to tell us how did you become the editors of the second edition of the book?
So I was chairing IPEM's Radiation Protection Special Interest Group, and we heard that the European the Euratom Basic Safety Standard, which sort of dictates what all the regulations across Europe should be for radiation safety, was being recast, as I said at that point. So we realised this would affect the medical and dental guidance notes that IPEM were now publishing, and therefore it seemed a good opportunity to get together a working party to revise them. So I proposed the working party, and we did this in collaboration with there's 4 different sort of radiation special interest groups, one for radiation protection that I was heading, and then there was one specifically for diagnostic radiology, one for radiotherapy, one for nuclear medicine, and those other special interest groups nominated representatives. So we had Lisa Rawley from nuclear medicine, and Philip Males from radiotherapy, Mark Worrell from diagnostic radiology, and William Mayers from the radiation protection special interest group. So the 5 of us then formed the editorial committee to working party to plan the new medical and dental guidance notes.
Right, thank you. And could you also tell us, so the second edition covers new radiation regulations. Could you tell us more about the main changes that have occurred in recent years?
So in some ways, a lot of what was in the old guidance things haven't changed. All the regulations, there's new versions of them, but the basic principles are the same about justifying radiation exposure and keeping doses as low as reasonably practical, and so on. There's been a few changes. For instance, new research showed that the lens of the eye was more susceptible to radiation causing cataracts, so the dose limit for the eye came down by a factor of more than 7. So we had to put more information about that in there. There's been a lot of developments, particularly in say nuclear medicine therapy. Lots of new radioactive isotopes being used for treatments, and the likes of me and people need to be able to give guidance when we're injecting this stuff into patients. What's the safety implications if they then end up, breaking their leg and end up in hospital for staff or whatever? So there's been a lot of work adding in new guidance for that, practical guidance for that. And then, I mean, one of the biggest changes since the last edition is really just before the last edition, there was a big change in regulations and a lot of things changed. And when the new edition, the previous edition gave a lot of good advice there, but it was quite new, the changes in regulation. But since then, there's been lots of guidance, lots of work. People have done developing procedures and so on. So we've been able to put all that into the new medical and dental guidance notes. All that extra information that wasn't available to the last working party put together the last one, we've been able to put in, which is why it's sort of increased by about 40% in size.
Right, that's impressive. I also wonder, do you mind telling us about the partnership with IPEM and how you came about editing the title along with Mohammed?
So as I say, I was chair of the IPEM. So I've been a member of IPEM since 1988 and been on the special interest group for radiation protection a couple of times. And I was chair at the time that we heard that the European regulations were being recast, as they said at those days, although recast is just like minor bringing things together and into one thing, but it was a lot bigger and it turned out in the end and took a lot longer. So it was a bit more work than we thought it was going to be. And then as I say, I formed the working party, and we worked over the years as we had to wait for a lot of regulations to actually change and come in and so on. And then when we had a final, we did a consultation with a lot of the regulators and professional bodies, gave them a chance to comment on the first draft. And then there was a lot more work to get the final draft. And at that point, Mohammed got involved. He's the editor-in-chief of the series, so he gave us a lot of help. He read the whole final draft and came up with a lot of really useful comments for us to revise that final draft and get it ready to go forward for publication.
Right. Excellent. Thank you. So MDGN provides general guidance on good practices. Who do you think is the primary target audience?
So number one, it's medical physicists who work with radiation or give advice for radiation. So often departments using radiation will go to the medical physicist for advice, and the medical physicist will have a look in the book and give them the advice, or the first time they're given that sort of advice, they look in the book. So they're really I think the primary audience are going to find it most useful. But it also can be useful for actual users, particularly so in our hospital, we've got radiation protection advisors and medical physics experts in the hospital, but a lot of other places they have to employ someone from another hospital, or we might be a long way away. So them in particular, it's useful for them to have the guidance notes, the actual user department, so that they can maybe turn to that first, and then if they can't find the answer there, ask their radiation protection advisor, or come up with a solution and double check with their radiation protection advisor that that's okay.
So perhaps making it more user-friendly in that sense.
So so that's what we've tried to do. Tried to make it as helpful as possible, and user-friendly as we can. Yeah.
Thank you. So since we touched that topic, can you explain the organization of the book and how the chapters are structured?
Yes. So people like it. We've structured it very similar to the last edition, and in fact, although the last edition is called the first IPEM edition, this is a book that goes back many years. It goes back to 1921, really, the first edition. So there were 7 editions that were published in journals, and then the government took over in 1948 and published 4 editions, I think, up until 1988. And then they decided they weren't going to spend money publishing this stuff anymore, so IPEM took it on. And the 1988 edition, published by what was then called the National Radiological Protection Board, was very good. And the IPEM took the same chapter structure as that, pretty much, and we've done the same thing. So there's one extra chapter, but apart from that, the first chapter is general radiation protection. So the general requirements of the regulation, how to keep staff and members of the public safe. So that's chapter 1. So all specialisms will find that useful. And then chapter 2 is the patient safety general chapter. So that's about patient safety and the regulations about patient safety and generally. So chapters 1 and 2, every hospital, every department will find them useful. And then we've got 4 chapters which are diagnostic imaging. So it's diagnostic radiology and dental radiology specific. So that's 4 chapters, and then 3 chapters which are specifically radiotherapy. And then the remaining chapters are mostly nuclear medicine. So there's quite a lot of them, and we've added one extra one. So PET scan, positron emission tomography. There wasn't a lot of that about in 2002. It's all over the place now. So we decided a whole chapter was useful for that. So we added one extra chapter compared to the last edition. And just about all the chapters have got a lot fatter since the last edition, as we put more hopefully useful information in there.
Yeah, that makes sense. Thank you. So since the last edition, there have been some appendices that have been removed and some others that have been added. Could you please tell us what the main differences are and why you changed the appendices in the way you did?
I'm going to look at my crib sheet for them because there's a long list of them.
Of
So,
course.
some of them that we removed, there was some. So there was an appendix on the role of the radiation protection supervisor. Well, that's now included in chapter 1, so we didn't need an appendix because it's inside a chapter. And there are a few bits like that, and then there were some things that were very specific. And are now included in other publications. So there used to be an appendix about how to calibrate radiotherapy equipment to do what's known as definitive calibration. Well, that's published in other IPEM specific radiotherapy reports, report 94. So there was no need for us to repeat it when it's there. It belongs to the radiotherapy community in their publication. So we took that out. And there were some that were just now obsolete. So there was some generic authorizations, they were called, under the 1999 regulations, which don't exist anymore. And there was some guidance that the inspectors for radioactive substances had issued in the 90s that didn't apply anymore. So we took them out. Now, what we then did is we added 10 new appendices, hopefully useful stuff. Some of them are examples and some of them are sort of to give you an idea for writing things. So they didn't really fit into chapters, but hopefully they're useful things that people can pick up and use. So we've got a chapter on examples of dose calculations for risk assessments, how you might work them out. A number of them got flow charts identifying persons exposed to ionizing radiation. So this is a complicated thing about whether someone's an employee or what's known as an outside worker, which is employee of someone else doing something for them, or if they're a member of the public. So that's not always clear. So we've done a nice flow chart to help people identify them, which helps them follow the regulations, keep the health and safety executive happy. We've got a chapter on shared learning for incidents, a chapter on life cycle of imaging equipment and what you do at the different stages. A chapter about writing what's known as IRMA procedures. These are procedures you need to have in place legally if you're going to expose patients to radiation. Chapter on risk communication. Chapter on dosimetry and radiomolecular therapy. So I said that nuclear medicine, there's lots more treatments using radioactive substances that didn't exist before. And there's an appendix which gives advice on how we can work out the doses that patients get in. And then also an appendix on the role of the radioactive waste advisor, which was a role that didn't exist as such in 2002. So hopefully these things will be useful and helpful to our readers.
I'm sure they will. So I wonder, what are you currently working on? Are you working on any new projects, perhaps?
Well, at the moment, like a lot of people who work in my field of radiation protection and diagnostic radiology, we're very busy with the expansion, really, of diagnostic imaging in the UK. So there was a report just after COVID called the Richards Report, which recommended, well, it showed we were a bit behind in how many CT scanners and the like we have in the UK compared to the rest of the world. And also, it'd be a good idea to be able to have diagnostic centres away from hospitals so that if there's another COVID type pandemic, we can still be imaging people away in community settings and not taking them to the hospital, which we're trying to isolate. So there's a lot of my times, there's a lot of these community diagnostic centres, which we've got a number going in my region. So there's been a lot of work on developing workforce plans for them to make sure we've got enough staff and giving them advice on the shielding for the building of them. So that's been sucking up a lot of my time in the last year or two. So I haven't rushed to volunteer for editing another report because I've been quite busy at my desk at the moment.
Wonderful. So one final question for you. What general advice would you give to those using ionizing radiation in medical and dental practice or research?
By the clinical and dental gut now. So I think take the advice that's available. So anyone using radiation, they should have a radiation protection advisor. If they're exposing patients, they should have a medical physics expert. And if they're using radioactive substances, a radioactive waste advisor. So take the advice, listen to them. I'd also say to them, to those who do my job, you know, remember we're there to help. We're not the police, but we're there to help people fulfill their role in diagnosing and treating patients. And the idea is to make that as simple as possible, as safe as, while still being safe and getting good results.
Sounds wonderful. Thank you very much. Thank you for your time.
Okay.
And thanks everyone for watching.